Welcome and thank you for joining me. My name is Lori Atkin and I'm a public health nurse and an STI clinician here at the Siouxland District Health Department. I'd like to talk to you a little bit today about syphilis. Syphilis is a sexually transmitted infection that can cause some serious health problems without treatment. As you can see in our county, from January 1st to November 17th of 2022, we've had 74 reported syphilis cases, and that includes all stages of syphilis. That is a significant increase as compared to the previous 4 years, from 2018 to 2021. We're also seeing a significant increase in cases among our Black and our Indigenous populations, but people of color overall are increasingly disproportionate. Syphilis normally starts with sores in the genital area, and those sores can be not painful or cause discomfort. So people don't realize that they have syphilis because it's not causing them any pain. Those sores are called chancres, and sometimes the chancre can be inside the female. So when they're not aware that they have it, they don't go seek medical attention. They're not coming to our STI clinic for screening and testing. And they're having sex with their partner or multiple partners, and they're spreading the virus that way. Syphilis can also spread from the mother to her unborn baby, and this is called congenital syphilis. And this can have some major health impacts on the baby. We've had some cases of syphilis across the state of Iowa, and one case of congenital syphilis is way too many. If you remember the gangster Al Capone, it was said that he went crazy later in life when he was in prison. He actually died of neurosyphilis. Syphilis can, once the chancres go away, you may develop a rash. You might see that rash on the palms of your hands, the soles of your feet, or on your trunk. Once the rash goes away, and if it's not detected and not treated in an appropriate manner, syphilis can affect the major organs of the body. It can affect the eyes and then go to your central nervous system, which is the neurosyphilis. Syphilis is easily treated with a form of penicillin, but what we're seeing is people aren't aware that they're infected or been exposed, and so syphilis then goes from primary to secondary to late or latent stage of syphilis. And so that's the number that you're seeing is all cases with all stages that were reported from January to November. So what can we do as a community? Well, the health department has been working with local providers and also the urgent cares and the ERs, and we're encouraging them to do a very detailed sexual health history and interview individuals and find out if they have multiple partners, if they've had any symptoms, have they noticed any sores, have they had any rashes that seemed abnormal. We're also encouraging them to follow the CDC guidelines as far as treatment, but if they have any questions, they can sure contact us here at the health department and we will guide them. We're also recording the syphilis podcast that you can find on the Siouxland District Health Department website. We're offering STI testing, including syphilis, around our community and at community locations, including the health department. We're also hosting a public health roundtable specifically talking about syphilis in January of 2023, and it's geared towards nurses and local medical providers in conjunction with the Iowa Department of Health and Human Services. We also have an STI coalition that meets monthly here at the Siouxland District Health Department, and we have community partners, we have hospital personnel, we have OB offices, primary healthcare providers, nurses, and we do have some local providers that sit around the table and discuss what we can do as far as education, getting the word out, as far as treatment guidelines. If you'd like to be a part of that, you can sure call the health department at 712-279-6119, and we can get you on the agenda, and we can get you on our listserv and let you know when those meetings are. We know that congenital syphilis is quite harmful to the baby. So like I said before, we know that one case of congenital syphilis is way too many. we can work together with the community in getting the word out, doing the appropriate screening, testing, and treatment, and we can decrease those numbers. And that is our goal. So thank you today for joining me. If you have any questions or concerns or need any guidance or information, please call us at the Health Department, 712-279-6119. Thank you.